This question came to me and I want to answer it. Sounding. The world of sex is interminable, and there may be as many sexual practices and preferences as people are in the world. And today we're going to go where we have not been before. Let's talk about sounding. Have you heard of sounding? Do you know what it is? Do you practice it? Are you curious? Well, let's have an in-depth chat about sounding. I am Dr. Tanji, the Sex Doctor Board Certified Clinical Sexologist, and the happiest person in the world since I get to work in this fascinating field of human sexual health every single day of my life. Welcome! Please subscribe to my channel if you haven't done so yet. Your subscription lets me know that you appreciate my content and helps the algorithm prioritize it instead of hiding it. We are not hiding or backing down from talking about all things human sexuality, and your subscription helps this channel grow and reach a broader audience. Join the Sex Intelligent Club for exclusive intimate content not available here. I'll give you a second to locate that subscribe button and click on it. Now, thanks. Okay, so back to sounding. What is sounding? Urethral recreational sounding is a form of sexual play that involves inserting a thin sex toy object, liquid, or gas into the urethra. Some people may start sounding with their fingers and move on to objects after some practice. So basically, people who like sounding do it for sexual arousal, pleasure, and to increase sexual satisfaction. How did sounding come about? In the medical field, a sound refers to an instrument that a medical professional places through the urethra for health purposes. Sounding is typically performed while a person is under anesthesia. However, some people may have urinary difficulties and they need to place a catheter through the urethra regularly or even live with one. Urethra play, catheter fetish, cock stuffing are other names to sounding. Why do people like sounding? Individuals who like sounding report that the act is stimulating and can heighten sexual pleasure by providing stimulation to the urethra, which is very sensitive, and some view sounding as taboo. If a person is able to insert a urethral sound deep enough, they may be able to stimulate the prostate, which can intensify sensation and orgasm. Sounding may appeal to individuals looking to explore unique or unconventional sex experiences, and it may be part of a broader sexual experimentation or curiosity. People may also engage in sounding as a way to express their kinky sexuality or even bond with a partner, as sounding requires skill and trust if done by someone else. What are the risks of sounding? Before I tell you, a PSA. Do you know that you can talk to me live? Go to the link in the description section of this video to schedule your time to talk to me. I hope to see you soon. Needless to say that sounding can carry multiple and serious risks. Studies have shown that men who engage in sounding were more likely to report other high-risk sexual behaviors and had increased odds of reporting sexually transmitted infections. Sounding also increases the risk of lower urinary tract symptoms, damage to the urethra, and erectile dysfunction. Other negative consequences of sounding are pelvic pain, obstruction of the urethra, hematuria, which is blood in the urine, or dysuria, which is painful urination, and changes to urinary frequency. Ideally, only a medical professional should perform sounding for health purposes in a safe and controlled environment. But if you are a fan of sounding or would like to try it, your body belongs to you. So here are some tips to make sounding less risky and more enjoyable. First, start small. Start with your finger, the smallest one, and go up from there. Be mindful of all sensations and stop if you feel pain. Sterilize. Proper sterilization before and after sounding is essential to reduce the likelihood of infections. Mind the size. Use a size that is appropriate and go slowly and gently to prevent discomfort while sounding. Choose the object wisely. A study that I will leave in the link below reported a case of a patient who inserted a round of live ammunition into his urethra, and the object had to be removed surgically and very carefully to not cause an accidental discharge of the round. That was not smart. If you must, choose objects that are soft and that you can retain control of on the outside of the urethral opening. Now that you know about sounding, what do you think? If you have practiced sounding, we would love to know. So share in the comment section. Yes, we're nosy like that. This is Dr. Tanti, the sex doctor after workout. And as always, I wish you safe, healthy, and pleasurable sex. See you next time.